Sharma is here.
Good afternoon, everyone. I will be presenting the comparison of pachymetry using anterior segment OCT and ultrasound biomicroscopy in congenital corneal opacities. As we all know, the congenital corneal opacities are etiologically heterogeneous group of disorder with challenging diagnosis and treatment. And early visual deprivation frequently result in severe sensory deprivation amblyopia in these kids. So measurement of central corneal thickness play an important role in both diagnostic and therapeutic assessments of ocular diseases. There are various tools which are used to measure the central corneal thickness like ultrasound, biomicroscopy, ultrasound pachymetry and OCT. But an ideal tool should be accurate, reliable, safe and non-invasive. So coming on to the ultrasound pachymetry, it's basically used as a standard in measuring the corneal thickness, and it's a contact procedure, and the perpendicularity of the probe with respect to the cornea is very important. But sometimes in dense corneal opacities, it could not capture the central corneal thickness. So ultrasound microscopy, it's high resolution, high frequency and real time, and it's used to visualize the anterior segment in corneal opacities also. Anterior segment optical coherence tomography is non-invasive, non-contact and fast method, and it has role in diagnostic and pre-operative evaluation of the anterior segment diseases also, and it has better resolution than the UBM. So in this study, our objective was to determine the interchangeability of the pachymetry measured by ASOCT and UBM in congenital corneal opacities. So it was a comparative consecutive case series which was done from January 2022 to January 2024. And all children below 5 years of age with unilateral or bilateral congenital corneal opacities were included in this study. All the children underwent examination under anesthesia and anterior segment OCT during the routine OPD visits. And outcome measures were comparability of the corneal thickness measured using ASOCT and UBM, and to assess the interchangeability of both the devices. So it's a short video how the ACCT was captured using ASOCT. In this, the child was, after applying the speculum, the child was the ASOCT was captured whenever the child fixates, because it take images in very short time. So pachymetry measured was horizontal images were selected to measure the pachymetry in both the devices from UBM and the ASOCT, and the inbuilt caliper in ASOCT and UBM were used to measure the central corneal thickness in both the modalities. And in the ASOCT, the central location is based on the scleral spur to scleral spur diameter, and the same location on the UBM image was used to measure the central corneal thickness. So in results, coming on to the results, the 54 eyes of 36 patients were imaged with both UBM and ASOCT, and the mean pachymetry measured with the UBM was 844, and with ASOCT it was 675. On Pearson's correlation, there was a significant correlation between the two CCTs on two-tailed test, but ASOCT was consistently underestimating the central corneal thickness values, and on Bland-Altman plot, there was lack of agreement between the two modalities. So we concluded that ASOCT and UBM correlate well in the majority of the cases, but the pachymetry values are not interchangeable, and UBM is still the modality of choice as it penetrates better in cases with the retrocorneal membranes and dense lenticular adhesions. So limitation of the study was lack of control group, small sample size, and lack of centration while doing the UBM and ASOCT. And there can be observer bias due to the manual measurements. Thank you.